Hi, Dr. DeBull here with North Oaks Dental in Royal Oak, Michigan. Today we're going to talk about dental implant failure. It's a little more serious topic. A lot of dentists don't like to talk about dental implant failure, but it is something that does happen. The fact is 98% of dental implants are successful. However, you have to figure out how to avoid those failures, and we're going to cover that today. So most dentists always talk about the successes that they see. We don't cover the failures as much. Dental implants have been placed in people's jaws for over 35 years now. So we have a lot of research to go back and look at. However, it's only in the last 35 years. There's been a great push for dental implants and people wanting them over the last 10 to 15 years. So there's a lot more dental implants being placed, which causes a lot more failure. There's a lot more dentists placing dental implants, which can also cause a lot more failures. Before, maybe you had a handful of people doing it, very educated, went through their studies using the best technology, and the success rate was a little bit higher. Now we have to make sure that that dental implant is placed correctly. Which are you going to use of the dental implant? Who's going to place the dental implant? How is the bone where the dental implant is being placed? And there's a lot more of them being done. So we do see failure in our area. So here I'm going to talk about 5 reasons why a dental implant can fail. The first reason is metabolic. Metabolic means what's happening inside of your body. For an example, on one of the posts that I did before, somebody mentioned that if you have diabetes, you can't get a dental implant. Now that's not necessarily true. However, if you have diabetes, your success rate of getting a dental implant is lowered if the diabetes is not controlled. So what we have to do is check your HbA1c level, which is a level tested to see how well controlled your diabetes is. There's a magic number 7. If it's under 7, the success rate is greatly increased. If it's above 7, you have a less chance of that implant working. So we monitor our patients very closely to see what their HbA1c level is, and if it's under 7, we're safe to say and tell you predictably that dental implant will work. The second reason why a dental implant can fail is smoking. Cigarettes have nicotine in them. With the nicotine, what that does is it constricts the blood vessels in your mouth so you don't get the correct nutrition to the dental implants, and the implant may fail. So what you need to do is find out, what we find out from our patients, do you smoke? And let them know if you smoke, the risk is higher. If you do smoke, we do have protocols on how much you smoke, how long you have to stop smoking before the implant's placed, and how long after. Typically, if you smoke under a pack a day, we can ask you to stop smoking those cigarettes for 2 weeks before surgery and 8 weeks after surgery. However, the smoking does lower the risk of the dental implant becoming successful. Another reason is actually unknown. Sometimes we look at the patient's metabolic, no smoking, the implant's placed, and the implant can still fail. Was there a residual infection there from the previous tooth? Was there a problem with the placement of the implant? Was there something metabolic that we don't know that's happening, and you just can't pinpoint it? So that does happen every once in a while where you get a dental implant that fails. What we do is remove the implant, clean the area up, put some bone graft in there, wait, and do it again. And in most cases, you get success at that point. The fourth reason why a dental implant may fail is because of lack of bone. So I did a video before about bone grafting and why that's important. Check out that video if you want to know more about the bone grafting. But the gist of it is that if you have a small amount of bone and you put a dental implant in there, those thin walls of bone can break down and the implant will fail. What some providers or dentists will do is put a smaller implant in there. In some cases, that's okay on a small front tooth, but for a back tooth or a molar, you're expecting it to hold a lot of forces of chewing. It's a much bigger tooth. Put a smaller implant in there, and you're putting too much force on the implant. It can't hold that tooth and all the forces that are being put on it, and it can fail for that reason as well. So the fifth reason why a dental implant will fail is surgical error. You might have a less experienced doctor doing the dental implant who hasn't done hundreds of them, who hasn't taken the correct courses to go through to get the proper knowledge, and they're placing dental implants. Like I said earlier, there's a lot more dental implants being placed out there right now because there's a lot more people doing it. So you want to make sure that the person doing it has the knowledge. We did a video actually not too long ago that talked about the 5 things you want to know about your dentist before getting dental implants. Make sure you check that video out. It's a really important message. You want to just make sure the right person is doing your dental implant for you. Well, I hope this video was very helpful. If you liked it, please like it, share it with your friends, help me get this message out there so we can help more people. Thank you. I'm Dr. DeBull at North Oaks Dental in Royal Oak, Michigan. Have a good day.